Good morning, good afternoon, wherever you're joining us from. My name is Jenny Njuki. I will be the moderator for this session. So I will be welcoming you to the Malaria Hot Seat webinar this particular Thursday on the 21st of 2022. So just to start us off, allow me to just quickly share what the Malaria Hot Seat webinar is all about and what we should be expecting this wonderful session to bring out. So I will quickly just jump into the objectives of the webinar, which is speaking to 5 key areas, really looking into the opportunities and how to improve coordination and efficiency of malaria control efforts. We will be able to look at the opportunities to manage and overcome supply chains disruptions, also being able to look at the current gaps and challenges in data quality and collection, and how can we be able to ensure that there is cross-sectoral engagement and public-private partnerships to address these challenges. So we will also be sharing about the new tools and innovations in vector control surveillance, looking into mobilize domestic resource mobilization for vector controls interventions in Nigeria. We do know that the successes achieved in the past decades are really being thwarted by the challenges imposed by COVID-19 and other factors. And according to the 2021 World Malaria Report, Nigeria did account for about 32% of the global malaria deaths in 2020, which was quite an increase over the 2019 figures of 23%. Therefore, this discussion is very crucial as a precursor to World Malaria Day, where we will seek to delve into the challenges into the challenges of implementation of malaria control interventions, some of the lessons that we have learned from COVID-19, and the opportunities to improve coordinations and efficiency of malaria efforts. Therefore, today we welcome both the public and private partners from around the world and Nigeria in particular to discuss the ways to improve coordination and efficiency of malaria control efforts and how we can ensure equity, resilience post-COVID-19. I will take this opportunity to also welcome the chairman of the Nigeria World Malaria Day Planning Committee, Dr. Diwe Ekweremadu, who's also the Deputy Chief of Party of the Catholic Relief Services in Nigeria. Dr. Diwe, I would like to welcome you to take the stage now to give us the welcoming remarks. Over to you. Thank you.
Thank you, Leslie. Thank you for setting the stage. That was really apt. Colleagues, good afternoon. And it's my pleasure really to be a part of this. We want to use the opportunity to thank GBC Health colleagues for setting this up. Interestingly, this is actually our first official function for the 2022 World Malaria Day commemoration. So thank you for taking the first shot. We really appreciate that. And we believe that with success on this webinar, the other activities lined up for the next week would also be super successful. So we really appreciate that. And we also want to appreciate other partners for all the commitments, all the efforts. It's been really very interesting last few weeks putting things together, but it's been amazing the level of collaboration between players across different sectors, both private and public. And we really believe that if we continue with this momentum, indeed, we are beginning to see the end of malaria across the globe and particularly in Nigeria. And just to also speak a bit to the theme, so we're looking at whatever we can do to ensure that we're advancing equity. It simply means it's not enough for us to target certain groups and be addressing malaria burden in maybe what you might call high burden or high risk groups. This time, we want to be sure that equity is on the agenda. So whatever we do, we are expected to be thinking in that direction. At the same time, we also want to ensure that we are all resilient as organizations, as individuals. Our interventions need to also continue to prioritize resilience, building the necessary level of partnerships and collaboration towards ending malaria. And on that note, I bring you goodwill from the entire World Malaria Day Planning Committee for 2022, and we wish everyone a happy webinar. Thank you, and over to you.
Thank you so much, Dr. Diwe, for those wonderful welcoming remarks and just reminding us that we do need to keep the momentum going to ensure that we end malaria in Nigeria. And that leads us to our next speaker, who is Dr. Perpetua Umoibi, who's currently the National Coordinator for Nigeria Malaria Elimination Program, who will be speaking to the opportunities to improve coordination and efficiency, looking at how to improve equity and resilience post-COVID-19, with identifying what are some of the data quality issues that exist. Over to you, Dr. Umoibi.
Thank you very much. Hello, everyone, and good afternoon to you too. And thank you, Dr. Diwe and Jenny, for those introductory remarks. So like you said, looking at Nigeria, Nigeria is peculiar in that with a population of over 200 million people and 36 states, plus the Federal Capital Territory, Nigeria is like 36 states or 37 states in one. So coordination in malaria control requires, requires efforts at the national level, the state level, the local government, or what some people call district level, collaboration and advocacy to ensure equity and prioritization of interventions to ensure coverage, looking at the available resources we have in country. So of course, we all know that Nigeria stands at the top of the high burden, high impact countries for malaria. And with 27% of the global burden and 27% of the global deaths, as was reported by WHO in 2020. And so malaria in Nigeria also accounts for about 60% of all outpatient attendance at health facilities and 30% of hospital admissions across the country. So you can see that we do require a lot of coordination and commodities in particular to address malaria diagnosis and treatment, and also other malaria preventive control interventions that the program is currently deploying. At the moment, we have a malaria strategic plan, a national malaria strategic plan, which is running from 2021 to 2025, which aims to achieve less than 10% of prevalence in children under 5 by 2025. Currently, with the last survey we had in 2018, the Demographic and Health Survey, we were at 23%. But at the same time, we had recorded some impressive decline from 42% in 2010. So by 2018, it was 23%. But we are hoping that by 2025, we will bring this burden down to less than 10%. At the same time, and we also hope to reduce the malaria, the deaths attributable to malaria to less than 50 deaths per 1,000 live births by 2025. So that's the current strategic plan. And of course, we are driving this through 5 strategic objectives that aims to ensure equity and resilience. Of course, we also hope to do this on a strong health system, because you cannot really drive the malaria control program without a strong health system in the country, sustainable health system. So we are doing that within, our strategic plan is riding and hoping on that, strengthened health system in the country. So some of the interventions, of course, is to ensure coverage of over 80% for the prevention, net ownership and use of over 80% by 2025. Also to ensure that all those seeking care and treatment, over 80% are able to get that by 2025. And then other interventions like ensuring that data availability and use for decision making across all levels, using data, whether it's survey data, routine HMIS data, surveillance data from all sources to ensure that we are able to put together all these data, and it will inform policy and decision making as well. Because there's other issues like a strong supply chain system and behavioral change communication strategy that will ensure uptake of this intervention for all Nigerians who need it. Because we know, of course, almost the whole country, over 98% of the country are affected by malaria, are all within the malaria zone in the country. So malaria is quite endemic in Nigeria at the moment as we are. No part of the country is spared for this. So in terms of the health products, malaria health products, basically we have been largely funded by two major funders. That's the Global Fund to Fight AIDS, Tuberculosis, and Malaria, as well as the President Malaria Initiative of the US government, mostly funding, but their funding is channeled to 2/3 of the country. And so we have 1/3 of the country that didn't have this major funding support for malaria. And this has also affected the outcome and impact indicators that we have for malaria over the years. So on the basis of that, the government looked to the banks, the World Bank and the Islamic Bank, to look for a credit facility to be able to support malaria in those remaining 13 states, including the Federal Capital Territory. So we are about to start off that implementation for the impact project. It's called the impact project. It's a malaria and immunization plus package to actually address under 5 mortality in the country. So with that, when that impact project starts, we will have a full coverage for across all the states of the Federation. And in terms of the commodities, we have huge commodity gap. We have, supply that we know. So Global Fund supporting these 13 states, PMI 11 states. And then the Global Fund is also working with 2 principal recipients, the Catholic Relief Services, while the National Malaria Program is in charge of coordination and oversight for the Global Fund grant. So this requires a lot of partnership and coordination on the part of the national program to ensure that both the sub-recipients, our partner principal recipient for the Global Fund grant, the sub-recipients, even other sub-recipients within the RSSH grants, we are able to collaborate with them to ensure that the country benefits from all these interventions for the malaria program in Nigeria, whether it's through the logistics system. We work with the chemonics, as the GSHC chemonics. We work with other sub-recipients, Management Sciences for Health, Malaria Consortium, PMI for states, and all the others, at the national level. And of course, we also have all this coordination platform as well as at the sub-national level, working with different partners. And of course, importantly, the private sector as well, who are also supporting us. We have foundations like the Dangote Foundation, Bill and Melinda Gates Foundation, Clinton's Health Access Initiative, and others who are also supporting us, whether in terms with technical support and also with funding for some of the interventions as well. Recently, the country scaled up seasonal malaria chemo prevention from 19 states in the Sahelian region of the country to 21 states of the country, based, of course, on the stratification that we did as part of the high burden, high impact approach. So we are now implementing SMC in 21 states, and with funding from different sources, including philanthropic funding from the Malaria Consortium. This is just to ensure that the whole country, there's equity in the malaria intervention in the country, that no one is left behind. The vulnerable population, pregnant women, of course, we are, providing SP, sulfadoxine pyrimethamine for intermittent preventive treatment of malaria in pregnancy. And then for children under 5, of course, this seasonal malaria chemo prevention is a very key part of that very impactful intervention that we have seen the results with testimonies from states telling us how how they no longer see so many malaria cases during the rainy season because of this intervention that has come to save their children. So we have to continue to ensure that those impactful interventions are reaching these vulnerable populations in the country. Of course, the Global Fund is also supporting us with providing interventions for the emergency, the states that are affected by insurgency and other humanitarian problems in the country, to ensure that the internally displaced persons in those populations, also whether it's in the IDP camps or in their host communities, also have access to malaria intervention that includes treatment, provision of nets, provision of RDTs for diagnosis and treatment, and then of course the ACTs for treatment as well. So the NMEP is ensuring that we have this equity and access to malaria control intervention in the country. Then during the COVID-19, of course, the program quickly put up a business continuity plan to ensure that there was no disruption. Of course, this was also based on the guideline from WHO, to ensure that we don't take our foot off the pedal. Otherwise, we are going to have resurgency and worst cases, based on and lose the gains that the program had achieved over the years, like I initially mentioned, in terms of declining prevalence of malaria in the country. So we put up this business continuity plan to ensure that we continued our intervention. In fact, it was during the COVID that we scaled up SMC, for instance, from the few states to a larger coverage. And we were able to do that successfully by modifying our implementation approach. Some of our guidelines for net distribution, for instance, we had to modify it to make sure that we still put into consideration the COVID, without exposing the beneficiaries or the field workers, those who are doing the distribution to COVID, while ensuring that people were still reached. Same thing for the seasonal malaria chemo prevention. We did some adaptation to the guidelines to ensure that coverage continued without necessarily putting people at risk of contracting COVID. In terms of the routine health facility system, of course, we also ensure that, working with other partners who were supporting us during the COVID-19, to ensure that health workers had access to personal protective equipment to continue to provide health services at health facilities. But we did witness some decline in health facilities attendance, particularly in the outpatient department, during the peak of the COVID-19, between July, particularly in 2020, between April and about July, August. Of course, that was due to many factors, apart from the fact that there was a global disruption in supply chain, which affected availability of commodities. There was also the fact that there was initial lockdown, so that also prevented people from going to health facilities, as well, of course, the fear of COVID. So people said, no, I don't want to go to the hospital, either to be told I have COVID because of the similarity between malaria symptoms and COVID, or to go and contract COVID in the health facility. So people resorted to community management for malaria when they had malaria. So we did see some decline in the health facility attendance, but it picked up later, and we have continued to see that in the routine health system for malaria. So basically that is looking at what we did during the COVID-19. Of course, we also had to modify the issue with the data, apart from the fact that we saw those initial decline, but we also had to ensure that the commodities that whether it's the nets that are being provided to the pregnant women and children under 5 at health facilities, for the continuous distribution channels that we have in the country to address the vulnerable. We also ensured, although of course due to the supply chain disruptions, we had some stockouts of some of these commodities like the nets and the ACTs and RDTs, but we knew why some of those happened. Some of the companies, resorted, they preferred to, like the RDT, for instance, they were providing RDTs for COVID rather than for malaria. And that affected also the availability in our health facilities, which affected our supply chain system. But so what has the government done? You know, we try to ensure that our HMIS and the logistic management information system continue to have strengthened enough to continue to report all these commodities, you know, stock outs, what is available, what is our stock, you know, line, you know, how much stock do we have for and so on and so forth. So we are able to monitor that through this LMIS system, logistic management information system in the country, while the service delivery data are being managed through the district health information system, which malaria completely used for its routine data. So we don't have any parallel reporting system for malaria. So we completely rely on the district health information system of the country. So we are able to track also our coverages across the different interventions, whether it's IPT coverage for pregnant women, those who are receiving 3 or more doses, whether it's you know, severe malaria. Recently, the country reviewed the HMIS form, the collection to ensure that we are now able to capture those women who receive 3 or more doses of IPTP. So these are some of the things. Then, of course, the warehousing and distribution, like I said, we are able to also work with clinics who are handling that to ensure that we have a good functional system in place for that. Particularly for the data, the quality of data is improving in the country, but we still hope to have further improvement, particularly comparing the service data with the commodity data to be able to track what we are doing. Reporting, of course, is still a challenge in terms of timeliness and frequency, but we are also working with the states and the districts and the local government to ensure that there's continuous improvement. And in terms of we recently also started triangulation of the HMIS, and that is the HMIS is the routine data, and the LMIS, which is the logistic data, to see how whether they are speaking to each other. We're doing it both at the health facility level, the local government level, where the data actually goes into the national instance, a reporting instance, and then even at the national level, we also, you know, do data quality audits periodically to look at what is happening at these service delivery points. So those are some of the things that the country is doing to ensure that we have quality data to inform policy and decision making in malaria. And then other collaboration, I've talked about the role of the private sector. So we do work closely with the private sector to help us to fill the gaps in the malaria program intervention in the country. I think for now, I will stop here. If you have other questions, I'll take. Thank you.
Thank you so much. Thank you so much, Dr. Moibi, for those invaluable, valuable insight that you've shared with us. Thank you so much for even just being able to bring out the milestones that Nigeria has been able to achieve this far, and you know, being able to highlight, you know, the decline that especially amongst children under the age of 5. I think that is quite excellent to see that Nigeria is able to do this, considering that we know that malaria is preventable and treatable, and it continues to steal the future by, you know, taking away from children who are the future generation of Africa and of course of Nigeria. Thank you for also just sharing about the, you know, the evidence-based data and what you have been able to do, and also being able to adapt to the current challenges brought about by COVID-19, but being able also to just call out on the need to accelerate commitment from all leaders and even to increase on investment, considering that, you know, the Global Fund the 2022 seventh replenishment of the Global Fund is this year, and we know what that would mean in terms of saving more millions of lives in Nigeria, but also in Africa and the world at large. But I think one key comment from you, Dr. Perpetua, is that no one should be left behind. The vulnerable community, women and children who bear the biggest brand, and no one should be left behind with the different interventions that are happening towards malaria elimination in Nigeria. I think that is such a great way to introduce our next session, which is really, we will have a panel session comprising of private sector participants represented by Dr. Laid Lessie, who's the head of occupational health at Chevron in Nigeria, Dr. Francis Aminu, who's the current director of health and nutrition at Aliko Dangote Foundation, and lastly, Dr. Kuku Apia, who's currently the director of medical and scientific affairs at Abbott Rapid Diagnostic. So with those remarks, I would like to welcome my panelists and just quickly jumping into the next session, looking into the panel discussion questions. And so I will just quickly jump into the first question, which will be addressed to the three panelists, Dr. Aminu, Dr. Apia, and Dr. Lessie. Dr. Aminu, how can private sector collaboration with public agencies and NGOs help build resilience in malaria control efforts in Nigeria, in Africa, and of course globally? And what stops private-public partnerships from happening a bit more often and more successfully as we would want to see?
Yeah, thank you so much, Madam Moderator. This is quite interesting and very, very important for us to look at, because there are a lot of misconstrued out there concerning the private sector and public agencies coming together, and then NGOs, which is the third leg of this issue. But I think we have to first and foremost look at the key areas that we really need them. And I think in the area of mobilization of new funding, very, very critical, because malaria program needs to be funded. How is really an issue that we look at as well. But when we say mobilizing new funding, it means we are mobilizing new friends. We need to mobilize new champions. And because out of our friends are those who are not even providing the service, but rather are those who purchase the services that are being produced, and then by extension, granting it to those who are less privileged or to their workforce and a host of other groups, all areas where their factories are located. These are issues we really need to look at critically and say, how do we then do this to mobilize this funding for that? It's very, very important for us to look at. We need to harness innovations, because the private sector, they are full of a lot of innovation that are really required to reduce the malaria disease burden and save a lot of lives and reach those who are still at the bottom of the pyramid, that could not afford to take those steps that they are asked to do, that cannot adopt those effective behavior change kind of practices that they need to adopt to keep safe and then keep healthy. The third one is we need to build stronger health system. There's no way we mobilize resources and mobilize other people and our health system is still at the point it is. We need to actually do that, and with our experience recently, we have mobilized private sector. They are now being engaged in Nigeria today. We had I think about 2 weeks ago, PHC sustainabilities, PHC summit, where private sectors are pledged to actually renovate and provide a kind of market-driven approach towards developing those primary healthcare centers. It has to be friendly to caregivers. It has to be friendly to patients and all the rest. So we need to look at that as well, where private sector can come in and work with government. Then we need to increase community surveillance. That the head of the NMEP in Nigeria said that earlier on. Data is very, very important. And when I say surveillance, we really need to be able to aggregate this surveillance and then be point specific as per what do we do, because they varies from one place to the other. And there are so many interventions that we need to really put together, but they are not the same. So that means whenever we get global agenda, global issue, global thinking, we have to act locally, even to our various communities, to be able to do this. Now, this actually called for, this cannot happen on its own. Like I always say, government on its own will have its own plan, carry the plan. Well, they invited one or two businesses, Aliko Dangote and the rest were there, and then they contributed. But the plan is still not their plan. That's just the issue. The same thing happens to the private sector. Private sector is thinking, oh, I think of my staff first. I have to address my malaria in workplace. Then private sector put up his own plan. And then it now goes to government. This is my plan. That's the way we are still operating. So we then need that public-private partnership in true sense of it. And the one that will be based on certain engagement approaches, not contract. You see, because that's another issue. Contract will always make individual in a contract to maximize their profit from that contract, maximize their kind of outcomes, their impact from the contract, rather than the real goal of the contract. The goal, because everybody going into contract means, oh, if I bring my investment, this is what is due for me. But when you use a PP kind of, I call it public-private engagement approach. It's an engagement and it's a long process. It takes a while to get that materialized. And a lot of them have taken place in Nigeria for different reasons, not really for malaria, but which we really, I can share if we have time to provide information on those ones. So in a private partnership, public partnership approach, we need a private company that will finance, that will build and operate some of the elements of those public service that we have to provide. The same thing is that, but they have to get paid for whatever they are contributing to that, like I said earlier on. So for us to be able to do this, we need an independent body. An independent body could be maybe a research institute. It could be a CSO, you know, in that true sense of it, that will help to support the public sector, because public sector has to unpack its own engagement dynamics, because you have to understand why this private sector should be there. And majority of the infrastructures, commodities are not provided by the public sector. It's still private sector that will have to do that. So, and then we have to build trust with the private sector. So that such a body will be able to help both the private and private sector to have trust in government kind of package that they have to deliver through. The same thing is they need to support the private sector on its own to unpack the system issues, because there are a lot of system issues that the private sector are still battling with, and they have to spend a lot of money in research and development that no one is actually doing to help them. And after you have exhausted your resources on that, you're still coming back to provide services. So we really need to put this in perspective, and so that at the end of the day, we have what we call a co-creation of action plans. You know, like we are talking about action plans for improving engagement and addressing these system challenges. Once we have that in place, and like I said, an independent body that can be CSOs, we need to build this kind of institutional and structural mechanisms, you know, that are really like brokers and supporters of public-private engagement, as I said, you know, and, you know, so be able to engage and then maintain the engagement for collaboration, because we have to sustain that. It is not one-time thing. That contract is a one-time thing, but engagement for collaboration is not one time. It continues, and it can come in terms of integrating various approaches. Thank you. Let me stop here, and then if there are other questions, then I can respond to that. Thank you.
Thank you so much, Dr. Francis, for that very, very elaborative response. And I mean, especially highlighting the need for that independent body that would sort of like bring together this concerted efforts by both public and private partnerships and looking into the synergies. But just on that particular note, allow me to jump into Dr. Leslie and just be able to have you chime in on this particular question around private-public partnership and drawing some of your thoughts on this as well. Thank you, Dr. Laid. Over to you.
Thanks very much, Jenny, for the question. I'll just jump straight into it. So we all know that the problem with malaria is huge. I mean, we heard from WHO that in 2020 there were over 240 million cases and hundreds of thousands of deaths. So the problem is huge, and it can't be handled alone. Private institutions cannot handle it alone, just as the government is and has been struggling. So collaboration really is key here. Cross-sector collaborations within the private sector would actually strengthen the health systems quite significantly. And with those sort of collaborations, each sector will bring in their own expertise into it. So there'll be pooling of resources really by all of these different sectors is what would help to move things forward and to strengthen the health systems that has been talked about, which is all required to try and fight malaria basically. So it's that collaboration that will be key. And for us at Chevron, we've partnered with alliances like CAMA, and we also are huge contributors to the Global Fund, PATH, and it's through those sorts of collaborations that we have been able to contribute to the growth to malaria. And some of the challenges that I believe a lot of the private agencies have, sometimes it's really the funding is not there. But then when there isn't funding, there's other bits of technical expertise that they can actually put on the table that would also go a long way. I think political will as well can affect how well people collaborate in these situations. And I think sometimes trust issues as well is part of why people hesitate with collaborating with agencies when they're not sure that their contributions would actually be put towards the purpose that they wanted to put forward. So I think those are the things that sometimes cause people to hesitate. But there's no question about the importance and the significance of public sector, private sector collaboration in helping this fight of malaria. Thank you. I'll stop there.
Thank you both to you, Dr. Francis and Dr. Leslie, for really being able to just bring out the need for concerted efforts, both by the public and private partnerships, and what this would be able to achieve even in terms of being able to build what we're calling the strong health systems that will ensure that, the different approaches and interventions that we have towards malaria eliminations remain sustainable. And I think that leads us even to what Dr. Perpetua earlier talked about in regards to evidence-based data, leading us really to our next question to Dr. Appiah around, treatment and diagnostic and other tools that need, strong supply chains and systems, and how did those systems really stand up during the COVID-19 pandemic in relation to malaria, and what are some of the experience, for example, from Abbott Rapid Diagnostics, and what would you be able to share, especially around this on health system strengthening and the different treatment and tools that have been used, and especially during COVID-19 and the experiences and that existed during this particular time?
Thank you very much, Jenny. So Abbott Rapid Diagnostics is one of the largest suppliers of malaria diagnostics within Africa, and specifically around what we call point of care diagnostics, which is basically the cold face of equity, because we're speaking of one of the themes is around equity. So a point of care diagnostic is what you'd call a rapid test that doesn't require any laboratory a system and can be conducted by a person who is not laboratory trained. It can be conducted in and outside of a health system. So we are leaders in supplying this kind of diagnostics for the malaria control and diagnosis and control within Africa. In terms of your question around how was the supply chain and systems affected by the COVID pandemic, definitely they were affected, and it was alluded to by Dr. Francis in terms of our manufacturing capacity, which was taken over because we also then became one of the largest suppliers of COVID rapid diagnostics during the pandemic. So the manufacturing sites and the shipment were all taken over by COVID. But what that says to me is that much more can be done for malaria in Africa if there's political will and if there's public demand for that. Because what we saw with the COVID pandemic is that as soon as there was political will, partnerships were formed, finances were reapportioned, and everybody put their shoulder to the wheel to push for the COVID pandemic. And as the malaria community, we'll need to demand this level of engagement for malaria, which has been there for the longest time, and we don't see the huge progress that we saw within the COVID pandemic. Vaccines being rolled out at a rapid stage for a new disease, whilst we fail to have the solutions for the old disease. So what we did benefit from this rapid and total engagement of the whole community, funders, partners, public and private sector. There are some major gains that we have also seen in terms of supply chain and the leapfrogging of technologies that maybe manufacturers and companies and developers had on the back burner, but were leapfrogged because of the COVID pandemic. And an example of that I would bring from Abbott is around the connectivity and the ability to pinpoint who has had a test, where the test was done, and let all that information feed into a central information system. So software and technology has been developed that was able to map out the COVID pandemic and is ready to go for the malaria pandemic, so that the malaria control program can see where the tests are being done, who did them, what the result was, and highlight that on a map, on an interactive map, to show where mini outbreaks are taking place, and use that to move resources. We moved resources for COVID. We moved healthcare workers were prepared to move from one point to the other during COVID. We need to continue to tap into that will and make it, because we don't have a clear maybe a clear objective for malaria in terms of what we want everybody to work towards. So this time needs to be used to regroup and coordinate and make sure that we have clear goals as the community, as the public and private sector, as an NGOs, working towards clear goals for districts, for communities, and for countries in terms of where we want, what are the statistics of malaria, what can be done. Because in the COVID pandemic, we saw that even the man on the street was deeply involved in the statistics, in the data, in the reporting of cases. That needs to continue going on, that it's more, malaria will have, controlling malaria in a community will have much more of a long-term gain for that community in the long term. So we need to harvest on those things. And as I say, much more can be done if there is if there's political and public will. Thank you.
Thank you so much, Dr. Appiah. I think that's quite useful to see and to actually, congratulations to Abbott, to be honest, especially around the work that you're doing around the manufacturing. But I think what is even more exciting is what you're doing around the evidence-based data that will really impact the work being done on the ground by by the National Malaria Elimination Program, especially around the data, because we know that data does speak and inform inform the interventions that are going to be deployed from both national to the district level. So I think that's been very, very insightful and exciting to hear in terms of what you're doing. And data is of course also used to shift the public perception to really be able to actually get that demand that we want, and that would again result to political action by our leaders. And this leads me to really our next question to Dr. Aminu from Aliko Dangote Foundation. Really, in your view, Dr. Aminu, what are the top 1 or 2 ways in which private sector can support efforts to advance equity in the fight to end malaria, knowing that, for example, women and girls bear the biggest brunt when it comes to malaria because they're disproportionately affected by malaria? What would be your thoughts around this in terms of how do we advance equity in this fight?
Yeah, thank you so much for this question. And I think, yeah, just like what I mentioned earlier on, and then broadly, I would like to just zero in on a few cases that we can really use. And it has to be because when we say building stronger health system, what I mean by that is not a question of building a health system that is meant for malaria control. No. We're talking of building a health system that would definitely, because that is the last kind of step by which people can have access to any particular health service. And it's at that point. And primary health care is such that even in one's lifetime, almost 80% of our lifetime, everyone would really is spent in the primary health care. So if it's built, and then we have private sector really contributing towards that and seeing it that way, then that's really an opportunity to advance the equity. Because again, like I always say, if you don't create a room for where people with the problem, because health center is supposed to be a problem solving place and not creating any problem for anyone, then you can really sift out with what Dr. Appiah just mentioned now, when you now have those data and getting the community mobilized to actually go there and have access to, regardless of your gender, regardless of your age, but that you have a problem, because it's a problem. So the community should be able to find the problem, kind of active case, because we are doing that right now with the issue of malnutrition. We start with malnutrition. And when you have a severe case, nobody can tackle the severe case at the community level. Then they can be referred to the health center. But you have to make sure the health center is in a position to receive such a problem and solve it. So private sector will have to then look at the health center and say, what are those needs, infrastructural gaps that they need to provide? I give an example. I will be mixing my example with that of, and malaria too calls for that, sanitation facilities, water facilities. You have to take care of that. If you don't provide that, the infrastructure, someone must provide that for you or for us to mobilize people to go there. That's one aspect of it I want us to look at. Then the aspect of it is at the community level, which I refer to as community surveillance. the people themselves should be able to identify and know, just like what the previous speaker said, should be able to identify and know here is a problem. Then everybody commonly within the community can refer to the health center for the solution. So that means we create what we call pull and push approach, whereby you have the community actually demanding for the services, creating demand at the community level, then they go, but the services must be provided as well. So private sectors have a role to play in actually ensuring that these two, this is like an experience we had too during COVID-19 when they set up the CACOVID. But CACOVID didn't just throw money at the problem, but rather they have to look at case management issues. How do we create isolation center? And then how do we manage cases at that? And then at the same time, how do you meet other kind of impact of our strategies on the people in such a way that, and that's the pushing approach from the community to actually go either for testing and then do it. But they just really need to understand this, and then they work together, and the private sector can easily come in. But finally, private sector has to ensure this is not a question of, because I always say that we have a goal to meet. I'm sorry to take more time on this. We have a goal to meet, especially on the part of private sector. A private sector that is doing this to promote its business, to promote and make more profit. That is not what we are talking about here. It has to be kind of part of the sustainability plan of the private sector, not necessarily CSR. CSR is good, but CSR, we know in most cases, they tend to promote. That is why we have the foundation. Foundation is actually here to even help the industry, to help our business units to actually be able to, put their resources into where they should be in order to support this endeavor from the part of government. Thank you.
Thank you so much, Dr. Francis. I think that was quite useful. And I do want to agree with you that, for example, Africa does lose about $117 billion dollars annually, and really for private sector to look into sustainability and ensuring that our labor workforce is protected and looking at it beyond CSR, because we know that we are strong as our weakest link, and therefore it's important that we ensure that there is equity, and when we say equity, we ensure that there is health for all. And again, that leads us again to really our next question to Dr. Leslie. Can you share one example of a private sector success in tackling malaria? And you could look at this from, Chevron and Chevron working towards malaria elimination, and what you would be able to share about a success story on this, in very, very few words, as we intend to also just move to our next session and look at some of the question and answers that have been shared by the audience. Over to you, Dr. Leslie.
Okay, thanks again, Jenny. So we talked earlier about the big collaborations that Chevron does with various other organizations. But charity always begins at home, and Chevron does a lot in-house as well. In the workplace, we have a lot around malaria education, and we do a lot around enlightening the workforce about malaria, everything about malaria really. So there's a huge amount of awareness campaign that goes on within the workplace that tells people a lot about malaria. And then also within the local communities a lot as well. There's quite a lot of malaria programs that go along. We've had various programs like Rollback Malaria Program, Malaria and Pregnancy Program. We have a group of people we call peer health educators that are not medical people, but they're trained on topics like this, and they go out into the communities to educate people about malaria, not just malaria, various other topics, but malaria is one of those that they handle quite a lot. So awareness really is important, and I think that is something that we need to bring up again in our community to try and help tackle malaria from a very sort of basic level. Thank you.
Sorry, thank you so much, Dr. Leslie. And that leads us really to our question to Dr. Appiah, in terms of how will the malaria vaccine fit within the bigger picture of malaria interventions? And do you have any concerns about the challenges to its successful rollout, even in Nigeria, as it's currently being rolled out in other countries in Africa?
I would just preface by saying that I'm not a vaccine expert. I'm more of a diagnostic expert. But in terms of the malaria vaccine, I would say that, you know, we welcome the vaccine because it is one of the leap step progress that we've been able to make in the malaria, in the whole battle against malaria, and also interesting and happy that it is focused on on children, infants, and young people. I think it's still early days for us to see what the actual impact of the malaria vaccine is going to be. But I think that as I'm repeating that, we look forward to the fact that there is something that has been brought onto the table that is a progress within the fight against malaria. So thank you.
Thank you, Dr. Appiah. I do agree. I think the vaccine is, of course, a game changer to Africa, but we also do admit that, you know, the vaccine together with the other interventions is what will lead us to success and really being able to achieve zero malaria in Nigeria, and being able to ensure that we eliminate malaria as a country. And this just leads me probably to our last question to our panelists before jumping into the question and answer. If there was one thing that you could change about how malaria is currently being tackled globally, what would you propose? And maybe I could start with Dr. Leslie, then come to you, Dr. Appiah, on the same, and end with Dr. Francis. Over to you, Dr. Leslie.
I would say that we should handle it the way we did COVID. It's not a pandemic, but throw a lot of resources at it like we did COVID, and hopefully come up with a really quick answer to address all of the various aspects of tackling malaria. Thank you.
Thank you, Dr. Leslie. I could not agree more that yes, we do need to probably look at it as the way we address COVID. Over to you, Dr. Appiah, and then Dr. Francis.
I would specifically like to see much better diagnostics being utilized throughout and in an equitable way, so that people throughout Nigeria and throughout Africa who might have malaria, have a fever, would be able to access quality diagnostics and quality therapeutics, which do exist already. So I would like to see much more equity, much more use of diagnostics, and even contact tracing, so that we can find out who are the asymptomatic carriers of malaria, how can we control them, how can we treat them. So I think there is a lot more that needs to be done. And I agree with Dr. Leslie that we need to continue with the momentum that came with COVID, and see that being used to target malaria in a very critical way in Nigeria and everywhere in Africa. Thank you.
Thank you, Dr. Appiah, on that. And yes, truly, I think evidence-based data will really help in terms of the interventions that exist currently, especially towards the efforts by government and private sector around malaria elimination. And thank you so much for those remarks. And over to you, Dr. Francis Aminu, with your closing remarks.
Yeah, I think I would like just to add that we really need to empower the community to deal with the situation more. We need to contextualize all this that we say at the global country level, but when it gets to country level, we hardly get to the people who are affected. So the people who are affected needs to really see and know, just like we normally say, it's different from other diseases where they wouldn't know the signs health workers too, but we know the science, we know how they can get it. So they need to really be empowerment to be able to participate in the process of treatment, the process of diagnosis, the treatment, and then even other control efforts that we have around for them to be involved with. Thank you.
Thank you, Dr. Aminu. I can see your hand raised by Dr. Perpetua. I will give this opportunity to Dr. Perpetua, and then we could just look at one more two questions from the audience directed to the panelists. Over to you, Dr. Perpetua.
Okay, thank you for the opportunity. Just on your last question, I think, beyond, of course, tackling malaria the way COVID was tackled with that coalition of public-private sector partnership and all that. And of course, you look at the speed at which vaccines came up, different kinds of vaccines and all that. For instance, what we have now for the malaria vaccine, which is a welcome development anyway, is just for children. But can we have more options, even in terms of vaccine production? That's one. But beyond that also, I think the way malaria is, in terms of funding, for instance, with support from donors, it's probably not the best way to go. I think countries should be allowed, to tailor interventions looking at local realities, and because there's no one cap fits all approach anymore, and so countries should be allowed to be on the driver's seat, make the decisions on what they think will work best in their locality, rather than coming with a pause from funders and say, this is what I want you to do. This is the way you should go, but allow countries to make more decisions. Thank you.
I mean, well put, Dr. Perpetua. I do agree that, we are best placed to actually come up with the solutions that affect the community and our people, and tailor and really inform what, the funding can speak to, other than, the other way around. But I totally want to agree with you. And the only way also, just to pick from Dr. Francis, is to empower the community that is affected by malaria. They need to have a voice. They need to actually make their own interventions, because at the very end, they're the ones that are affected by malaria and know what is best for them and their community at large. And so, I will just quickly pick one or two questions from the audience that have been shared on the chat box to our panelists. And with this, then we could be able to come to a close to this session. I'll pick one question to Dr. Aminu. Thank you very much. Great on sustainability of the private sector contributions to health and malaria. How could private sector strengthen the corporate social responsibility, CSR, without necessarily going into the foundation level? That will be to Dr. Aminu, but also a question that probably I could share this to Dr. Leslie and Dr. Appiah as Dr. Aminu prepares to answer that, is it is very exciting to hear how technologies are developed to manage COVID-19 and how this can be repurposed and adopted to the malaria space. So how can technologies be developed to manage COVID-19, and how can this be adapted to the malaria space? And congratulations to Abbott for helping to lead this effort in data collection and management. So I will start with Dr. Francis and then over to you, Leslie, and Dr. Appiah. Thank you.
Yeah, thank you so much for that very great question. I really agree with that question. Yeah, CSR as it is a very good concept, a very good approach for businesses to make commitment to actually contribute to sustainable economic development, while working with their employees, their families, the local community, and society at large to improve quality of life. Ideally, that's what it stands for. Something that will be good for both business and good for development at the same time. Yeah, they don't necessarily have to set up foundation, but we have seen businesses, and we have had the experience too, even in COVID. You'll be shocked to see individuals that have the resources, but they don't have the structure on ground to push through to implement. They rather will look for a foundation to partner with. And we do that a lot. And it happens a lot too in CAMA, where we see all of us having integrated intervention, vector control of malaria, and then we have all coming together, but not necessarily with your products, with your services, can be taken up by a foundation that has the structure to lay this out, for implementation. And we did that during COVID-19 too, in COVID. Till now, our office, the office of the foundation remains your office for the COVID, and we're doing that along with our job, and then we are helping others who make the investment, and then their investment counts based on how they want it. That's what I just mean by that. So I don't mean they should set up a foundation, but they need a sustainability plan. They don't wake up and say, wow, I heard there is malaria. Oh, well, how much should I bring for malaria? No, but think through it. Dangote itself, while we have the foundation, the business side has what we call Dangote Way, Dangote Sustainability Plan. That is both good for the business and then for the employers, and then the development as a whole. So that is what is really required. They can set up their own plan. They must have a plan towards sustainability, towards making those commitments, towards making those investments to be able to do that. That's what I'm just trying to expatiate here. Thank you. I hope I answered that with that person.
Thank you, Dr. Francis, for that answer. And thank you for letting us know that we don't need to set up a foundation, but we can work with foundations that continue to exist and bring together our synergies. And in terms of sustainability, we must plan even as we aim to ensure that, private sector is chipping in to meet the country's financial gap. We need to plan and have a sustainability plan that will ensure that in whatever private sector does bring in, it's able to impact in the long run, but it's able to be sustainable really over the period of time. So I will hand over to Dr. Leslie and then of course to Dr. Appiah. Please let me know if you need me to repeat the question or if you'd just like to go ahead and respond.
Yes, the question was about technologies and how that would help. And I mean, I think it is helping already, particularly with the vaccine that has come out. It's not perfect yet, but technology is what is going to help to get that better and get it to be more effective. Dr. Appiah has already talked about technology around the RDTs and how that can be used to collect data around. I'm sure she'll talk a bit more about that, and so that is going to be very the testing is actually going to be very, very helpful in addressing the malaria issue. And data has been alluded to by everybody, is going to be very, very, very key in helping us move things forward. Thank you.
Yeah, and so I'll give two examples of how technology is being used or can be used to address the malaria fight. And one is around improved diagnostics. So there had been a call out some years ago to look at the population of people that are in the community that are what you call asymptomatic carriers or asymptomatic harborers of the malaria parasite. And so that Abbott has been able to produce a diagnostic test, which is 10 times more accurate than the current diagnostics, and is able then to diagnose people. So once you have an index case of maybe a child that presents to a healthcare center with symptomatic malaria, one would want to know who in that child's household or nearby community might the child have contracted the malaria from, or might be an asymptomatic carrier. So using a much more sensitive diagnostic, but this kind of intervention needs the public health structure and the health system strengthening the health system to be strong enough that once a child presents with malaria, there is it triggers off testing of the household, and testing and treating of the household and of people in the close by vicinity. The same way, if the child was in a boarding school, for example, testing of the other children in the boarding school to see who else has malaria, and could the vector have just collected the malaria parasite from one person to the other. The other example is what I gave earlier on, which is around the software and the connectivity platform. So this platform existed prior to COVID, but was maybe not enthusiastically uptaken by program managers in the country. But with the COVID and the requirement for a program manager to report daily, weekly, monthly statistics around COVID, then there was a quick uptake of any connectivity solutions, which would be able to have people, the healthcare workers on the ground, going from house to house, conducting tests, using their Android phones and a software loaded on that to record with GPS pointing where they have conducted tests and what the test result is, and without any patient identifier. But that pops up then on an interactive interactive desktop that the program manager at district or at provincial or national level can see, and see where are the positive cases coming from, how much testing is being done in different geographical areas, and be able to then report back into data information, also lab information system or any other health management information system, but also then to use that to plan for resources. And that is product agnostic, and it is able to be used whichever rapid diagnostic would be on the ground. But that is a technology that we have developed and rolled out in some countries in Africa. So, and we're seeing a high adoption of that technology. So it is something that's basic. It also works on the fact that it doesn't necessarily have to have an active connection at the time when the data is being inputted. It can input overnight when the healthcare when maybe the bandwidth is better, and the healthcare worker's phone can then or whichever device you provide can be used to uptake all that information and make a useful surveillance of the disease, so that we know what and help people to tackle malaria in geographical regarding the geographical situation of the malaria in their specific country. Thank you.
Thank you, Dr. Appiah. I think it's quite exciting to see how, especially in this digital era, to see how technology continues to shape our interventions and approaches that we continue to use even in eliminating malaria. So I would like to say thank you to all of our panelists for this insightful and useful information. And we hope that this roundtable provided some insights into the importance of, cross-sector collaboration between the public and private sector to advance equity, build resilience, and end malaria, which is the theme for this particular World Malaria Day, because we are very sure that every effort counts and we need to fight for what counts. So I will take this opportunity to introduce one last speaker, Leslie Ann Long, who I did have the privilege to meet in my previous career at AMREF. Wonderful, wonderful lady. She is the president and CEO of GBC Health. Leslie Ann has a strong record of achievement in the fields of global health, digital technology, international development, higher education, and law. And of course, over the course of her career, she has developed a reputation for inclusive, collaborative leadership and successfully orchestrating ambitious new initiatives in the fields of global and digital health. Over to you, Leslie. Thank you.
Well, thank you, Jenny. I feel I should retire after that wonderful introduction and say no more. So thanks for the great moderation. You've been fantastic, and all of our speakers. It's just been a real joy to hear from all of you and the challenges that you're tackling. And, you know, as you've all said, this is a really crucial time to intensify efforts around malaria elimination. And Jenny, you opened this conversation by alluding to the impact of the COVID-19 pandemic on global supply chain disruption, on the ability for people to get to health facilities, and on healthcare delivery itself. And as Dr. Perpetua said, this is not a time for us to take our foot off the pedal. Now, I'm not going to try and summarize all the amazing comments and remarks that we've heard over the last hour or so, but just to pick out a few points. Dr. Dewey set the scene with reference to, and Dr. Francis said the same, this critical need for coordination. I mean, we're not short of efforts in tackling malaria. The challenge is around collaboration and coordination, in addition to being able to, as other speakers have said, embrace the new technologies that, particularly during COVID, have been able to leapfrog some of the older approaches to health service delivery. And we've heard from Dr. Leshy and Dr. Appiah around the critical use of data and the use of rapid diagnostic testing and contact tracing. And there's been an emphasis throughout on equity and on resilience. And Dr. Francis alluding to the importance of involving communities from the start, as well as building trust throughout the health system more broadly between public and private sector. And so there's a common approach to all of these ways of thinking about and tackling malaria. And GBC Health is proud to be doing this with partners as part of a 3-part series. Starting today, we've got a second event taking place on Monday. We're doing this in partnership with the BMJ, the Health Education Trust in the UK, Wellcome and others. This is the 6th East Africa Health Summit. And given that it's on World Malaria Day, we're also hosting a panel on malaria. And we're working with the parliamentary chairs of health and malaria from Uganda and Tanzania. And we'll have a number of other panel speakers joining us for that as well. In June, our 3rd event with some of the same partners is taking a deeper dive on the malaria situation in Nigeria. And that event will be co-hosted with NMEP and with WHO. And I'd like to give huge thanks to our partners, Abbott, to our sponsors across all of these 3 events. I'd just like to end by saying a little bit about the End Malaria Project, which CAMA launched in 2021. This is an initiative that we're working with partners in Nigeria, including with the private sector, to catalyze their resources and capabilities. And our goals are to increase awareness of and support for the national malaria control efforts that you heard earlier in this webinar. But what we're planning to do over the next 3 years is to work with governments in additional countries to share the lessons that we're learning from the End Malaria Project and look at how these might be adapted more widely across the region. So this is only the start of the conversation as far as we're concerned. We've heard about the challenges, we've heard about the opportunities today. Our speakers have been really focusing on resilience and equity, but there's also been a bit of a call to action. This requires the efforts from everyone. There's no one organisation, no one government, no one institution that can tackle malaria on their own. And so the efforts of collaboration and coordination, as many have said today, intensify the efforts in the same way that the efforts were used to tackle COVID. As Dr. Francis said, it involved the person on the street. They were engaged in what their role might be to tackle COVID. Let's see if we can achieve the same to tackle malaria. Thank you again to all of our speakers, our partner Abbott, and every one of you who've taken time out of your busy day to join us for this webinar. We've really appreciated your time and your questions. Thank you very much, everybody. Bye-bye for now.